Fatty liver disease. The silent epidemic. How to detect, reverse, and prevent it. Scientifically, the silent killer inside you. Every third adult across the globe is silently living with fatty liver disease, and the vast majority don't even realize it. There are no clear symptoms in the early stages, no alarming pain, just a quiet, progressive damage to one of the most vital organs in your body. Your liver, which performs over 500 life-sustaining functions, can gradually become inflamed, scarred, and even fail, all without warning. So ask yourself, could your liver be silently under attack right now? In today's video, we'll uncover what fatty liver disease really is, the science behind its causes, the subtle symptoms you shouldn't ignore, cutting-edge diagnostic tools, proven ways to reverse it naturally, and the most promising medical advances to protect your liver. What is fatty liver disease? Fatty liver disease occurs when excess triglycerides, fat molecules, accumulate in the liver cells, hepatocytes, reducing liver function over time. There are two major classifications: NAFLD, non-alcoholic fatty liver disease; AFLD, alcoholic fatty liver disease. NAFLD is unrelated to alcohol consumption and now affects over 25% of the global adult population, making it the leading chronic liver condition worldwide. Fatty liver progresses in 4 key stages. 1. Simple steatosis, fat buildup without inflammation. 2. NASH, non-alcoholic steatohepatitis, fat plus inflammation plus damage. 3. Fibrosis, development of scar tissue in the liver. 4. Cirrhosis, irreversible scarring and liver failure. In some cases, this can even progress to hepatocellular carcinoma, a primary liver cancer. Causes and risk factors. The root cause of NAFLD lies in metabolic dysfunction. It's often linked to metabolic syndrome, a cluster of conditions that includes 8. Abdominal obesity, elevated blood glucose or insulin resistance, high triglycerides, low HDL, good cholesterol. Hypertension. Key triggers include diets high in added sugars and fructose, especially from soda and processed foods, lack of physical activity, overeating and caloric surplus, poor sleep and stress, which raise cortisol and worsen insulin resistance. Genetic factors including variants of the PNPLA3 and TM6SF2 genes. Interestingly, even individuals with normal body weight can develop NAFLD, a condition known as lean NAFLD due to insulin resistance and visceral fat. Certain medications, such as corticosteroids, tamoxifen, amiodarone, and methotrexate, can also contribute to fatty liver. Symptoms and early signs. Fatty liver disease is often called a silent condition because it produces few or no symptoms in its early phases. However, some subtle signs may emerge: persistent fatigue or sluggishness, dull pain or heaviness in the upper right abdomen, unexplained weight gain or trouble losing weight, mild digestive discomfort or bloating, elevated liver enzymes, ALT, AST, in routine blood work. In advanced stages, the symptoms become more pronounced and dangerous: jaundice, yellowing of skin and eyes, abdominal swelling, ascites, mental confusion or forgetfulness due to hepatic encephalopathy, muscle wasting and easy bruising. Diagnosis and tests. Early detection of fatty liver can save your life. Doctors use a combination of blood tests, imaging, and sometimes biopsy to assess liver health. Key tests include liver enzymes, ALT, AST, GGT, lipid panel, fasting insulin, and HbA1c. Ultrasound can detect liver echogenicity. Fibroscan uses elastography to measure liver stiffness and fat. MRI-PDFF, the gold standard for quantifying liver fat. Liver biopsy, used in unclear or advanced cases to stage inflammation and fibrosis. To assess progression risk, clinicians may use NAFLD fibrosis score, FIB4 index, or APRI score. These tools help guide management without invasive procedures. Dangers if ignored. If ignored, NAFLD can lead to serious and irreversible consequences. Fibrosis, or scarring, limits blood flow and function. Cirrhosis, where healthy liver tissue is replaced by scar tissue. Portal hypertension and risk of internal bleeding. Liver cancer, HCC, in advanced NASH. And most importantly, cardiovascular disease, which is the #1 cause of death in patients with fatty liver. In other words, fatty liver isn't just a liver problem. It's a whole-body metabolic crisis. Reversing fatty liver naturally, science-backed. Now for the good news, fatty liver can be reversed, especially in early stages, with evidence-based lifestyle interventions. Weight loss of just can significantly reduce liver fat. 10% or more can reverse NASH and even some fibrosis. Best dietary strategies. Mediterranean diet, rich in olive oil, vegetables, legumes, fish. Low carbohydrate diet, reduces insulin and triglycerides. Intermittent fasting, e.g. 16.8 or 5.2, to improve insulin sensitivity. Eliminate fructose, sugary beverages and ultra-processed snacks. Eat more omega-3s, leafy greens and fiber. Exercise. Aim for 150 to 300 minutes. Week of moderate aerobic activity. Combine with resistance training for better metabolic benefits. Sleep and stress. Sleep 7 to 9 hours. Practice mindfulness or yoga to reduce cortisol, reduce alcohol and avoid hepatotoxic medications. Medical and emerging therapies. For those with advanced fatty liver or NASH, medical interventions are becoming available. Promising therapies under study or in use include pioglitazone, improves insulin resistance and liver histology, mainly in diabetics. GLP-1 receptor agonists, e.g. semaglutide, liraglutide, shown to reduce liver fat and inflammation. Vitamin E, antioxidant benefits for non-diabetic NASH. Obeticholic acid, under investigation in phase 3 trials. Probiotics and prebiotics help improve gut-liver axis and reduce inflammation. Bariatric surgery can induce remission in severe obesity with NASH. Always consult a hepatologist or endocrinologist before starting medications or supplements. Prevention and daily habits. Preventing fatty liver is easier and smarter than treating it. Daily habits for liver protection. Eat whole foods, not processed junk. Walk 10,000 steps day or more. Avoid high fructose corn syrup and trans fats. Limit alcohol, especially if you're already overweight or diabetic. Keep track of waist circumference. Abdominal obesity is a red flag. Get your liver enzymes checked yearly if you're at risk. Think of your liver as a metabolic engine. Protect it like your life depends on it, because it does. Recap and call to action. Fatty liver disease is a silent epidemic, but it doesn't have to be a silent killer. It's detectable, it's reversible, and it's preventable with small, consistent change. So take charge for yourself and your family. Eat better. Move more. Sleep deeper. Think smarter.
If you like this video, please consider subscribing for more content like this.